My name is Jale Tang. I'm an emergency physician working in Hospital Universitario La Paz in Madrid, Spain.
How are you feeling right now?
Fully recovered since a week ago.
Can you talk to me about your experience with COVID-19? What symptoms were you feeling? And you're a doctor, so you were able to actually show us your lungs. So can we talk a little
Mm.
bit about that?
So at the beginning, my symptoms were really similar to a cold. I had some dry cough, some chills, low-grade fever, and a headache. As the days were passing during the first week, I started with diarrhea, mild diarrhea, nothing really serious, with a terrible headache and weakness, and I started to lose the sense of smell and taste. After the first week, things got a little bit worsened with more weakness, more cough, and that was more I was more symptomatic than ever before. And then the third week, I started to improve, and my symptoms got resolved by then.
So can you talk about how you witnessed your lungs changing from day one to the third week?
What we see in COVID-19 is that as the inflammation of the lungs increases, the air in it lowers. I go from a fully air-filled lungs to a more inflamed one with more water-filled one lung. And then as my symptoms resolve and also the inflammation of my lungs, I was able also to catch that on my ultrasound.
You posted that you went back to work. So I'm curious about how you know that you're no longer contagious.
Mm, According to our protocols, you need to get a PCR test again, and before going back to work, it has to be negative. Asymptomatic. I must have no symptoms for at least 3 days and a negative test to return to my work. And even that, with that, I still have to take into account any precautions measures during my work. So I wear a mask and gloves during for at least 2 weeks. While I go to see my patients, I need to wear the whole protection equipment gear to see them as well.
What advice would you give to someone who doesn't have the tools, the access to the tools that you have to check your lungs? And, people are scared because this is like new, something new. Although it's similar to flu when it comes to those symptoms, but people are dying at alarming rates. So, what advice would you give to someone who already has it or thinks they may have it?
The most important thing to do is to self-monitor the symptoms, the red flags. And even though I'm not saying this disease is like a flu, because we all have seen that many people, young people, are dying. And even that young people have prolonged causes, just like my case. It took me almost 3 weeks to recover from this. So I don't want to say that be careless about this disease. It's not my message, but I want to send a reassuring message that most of the sick patients recover from this disease, and the news we hear about the people who die are mostly people with patients with risk factors. If we have symptoms, we have to monitor those and to take all the precautions we can at home. And second, if you don't have symptoms, to self quarantine, isolate at home, and to reduce all the contacts, social contacts, as much as you can, especially with old people or people with risk factors. I would recommend, strongly recommend, not to self-medicate.
And in your professional opinion, when do you see this pandemic ending?
It's hard to say it, but let's take a look to the country with most cases and where everything started. China is now opening, especially Wuhan is now opening, and this started 3.5 months ago.
And do you think that COVID will become seasonal like the flu?
I do believe it. Yes, as people gets immunized for after getting contact to the virus, will develop antibodies and immune response. What we don't know now is that immune response will last for how much.
Is there anything else you'd like to add?
Good luck. Don't lose your faith. This comes to an end, and really, all our support from Spain.